So, learning isn't just about collecting information, learning is updating your thinking. The best leaders don't just ask, "What do I know?" They also ask, "What would cause me to change my mind?" or "How could I think about this differently?" So, this week, you might have heard or seen that Dr. Anthony Fauci is back on the center of national attention. There was this contentious Senate hearing earlier this week about the origins of COVID-19, some of the things he wrote in his diaries, some of the things he said, and maybe some challenges with all those issues. But the hearing really just reignited debates that have been going on for several years about what was going on with COVID and what wasn't going on. And it's so interesting that people are looking at the things entirely differently. So what's fascinating to me isn't whether you agree with Dr. Fauci or disagree with him. What's really fascinating to me all these years later is that people really aren't interested in learning. They're not interested in learning anything new, that's for sure. They're rather better about proving themselves that I was right all along. Hi, I'm Bruce Spurlock, a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. On Viral Healthcare, we look at the ideas spreading across healthcare and what it takes to implement them wisely and sustainably. So, as I'm recording this episode, Dr. Tony Fauci is once again making headlines. This is like how many years after the COVID-19 pandemic? But he's back before Congress answering, or maybe not answering, questions about the decisions and comments he made during one of the most scrutinized public health events in modern history. I don't really want to talk about whether Dr. Fauci was right or wrong. Reasonable people can disagree. I mean, that's not really what interests me. Here's what I find fascinating from this whole episode, from all of the discussions. If you listen to any conversation about Dr. Fauci, what you're learning from is that most people aren't talking or listening to learn about something new, to discover what we could have done differently to make ourselves healthier and safer in the future. What they're listening to do, or what they're talking about, is something to prove that they were right, that they could defend what they already believed, and that they could find more evidence that supports their positions. And this is not unique to any group. Supporters do it. The critics do it. So many people, very few people, in fact, stop and ask, what have we learned and what could we have done better? Mostly they ask, how can I prove I was right? And that's a hugely important difference, because sometimes in healthcare, we do exactly the same thing. So healthcare is this profession, this industry that prides itself on being a learning industry, a learning profession. I mean, I don't know about you, but we're constantly reading. There's so many journal articles out there that we need to keep up with. People attend conferences and webinars. They review dashboards and see national reports about performance that we're doing in healthcare. We have experts talking about how we should change and adapt and do new things. There's new research coming out all the time. I mean, this constant learning and information explosion that happens in healthcare is profound. But here's the problem. Information doesn't automatically improve organizations. Just the data itself is not enough. It's necessary, but insufficient to keep going on. Here's what really helps is learning. When I find a true learning organization, one that really wants to understand their mistakes and scrutinize them in a really transparent, honest way, where it's not about blaming, it's not about shaming, this learning organization is so different than the information-oriented organization. So I think there are just two different approaches to it. Type 1 is somebody that accumulates information. And because they accumulate information doesn't mean they really have an understanding about what's happening. So they read another journal article, they go to another conference, they maybe participate in another keynote, or they listen to podcasts or another dashboard, or maybe they want another certification and initials after their name. Healthcare is really, really good at this. We reward this, we promote people from this, but collecting information doesn't mean you have understanding, and it may not even change anything to begin with. So type 2 is where you potentially change your mental model. What if you were able to say, I hadn't thought about it that way. I wonder how we might make this work in our organization. What would happen if something else is better? Is there something else better out there that I can seek? the evidence has changed, but is it important that it's changed? Or maybe I wonder if I need to rethink this. That's real learning. That's this sort of curiosity, open-minded. I think there's potentially other perspectives, other alternatives that would illuminate, help us grow and understand, and then make things better in the long term of healthcare. It's how we change future decisions. So I want to make sure that we talk about some of these biases. We've been here on our podcast before. Confirmation isn't learning. One of the biggest obstacles to learning and decision making is confirmation bias. We've mentioned that dozens and dozens of times. Once we form an opinion, and we often form it with very limited amounts of information, we naturally look for other evidence to support it and ignore or explain away anything that challenges it. Have you ever thought about this yourself? I do it all the time. I have to force myself to stop and say, wait, you're just definitely reinforcing what you think is right. And it's just a natural human tendency. You're not right, you're not wrong, you're not good, you're not bad. It's just who we are. The result is we become more confident, or a word I like to use, we become more certain that our way is the right way. And this doesn't make us any more accurate or any more right, just more certain, more confident about it. So if every new piece of information simply strengthens what you already believed, you're probably not learning. You're just collecting information. And confirmation feels remarkably similar to learning. And it's a dangerous, dangerous human bias that we all have. So let's go into the area that I have the most experience with is quality improvement. A hospital, a medical group, health plan, some organization launches a new initiative. And if it succeeds, then some of the people around it would say, see, I knew this would work. But if it's struggling, if it hits plateaus, if it's not making the progress that they intended it to, then they start into blame. It's implementation, it's staffing, it's leadership. We don't have enough resources. We're not ready for it. The timing is bad. It goes into this blame and shame, this explanatory kind of stuff to try to do almost anything except challenge the original assumption. But the organizations that improve the fastest ask a very different question, not who was right. They start looking at what did we learn, and everything, even problems, challenges, failure becomes an exciting opportunity to grow the organization and say, wow, that didn't work. Let's keep going. What else did we learn? Wow, that worked, but it didn't work quite like we did. What else can we do? Once learning becomes more important than being right, it's dramatic how improvement accelerates. Let me say that once again. Once learning becomes more important than being right, hold just on to everything, because improvement is going to go crazy. So let's bring this back to viral healthcare, the topics we've talked about in our podcast. We've examined and explored a variety of healthcare trends, some that worked, some that didn't. We spent a fair amount of time talking about hype and talking about why people have FOMO, smart people, intelligent people, and what it means, how to sort of slow down on your decision making, and what problems we have with these biases and the ways we approach decision making. We've talked about different ways to implement and these concepts of fidelity and adaptability. And we've looked at how do we really pull apart the components to an innovation, to an idea, a new platform, something that you're talking about and implementing, and figure out how to make it better. But here's the truth. None of that really matters if you're unwilling to change your thinking when new evidence appears. I think it's one of the biggest leadership lessons there is out there. The goal isn't to defend yesterday's opinion. The goal is to make tomorrow's decision better. And if you want to think about it this way, learning isn't defending yesterday's opinion. Learning is improving tomorrow's decision. I'm just going to keep saying that over and over through these podcasts. Learning is improving tomorrow's decision. So some real practical questions if you're evaluating an idea, a new innovation, a platform. If any of these things are on your desktop right now and in your sweet spot that you're working on, what evidence would actually change your mind? How would I sort of accept that this is going to fail? And that's where we talk about the pre-mortem. Am I looking for understanding, or validation, what I think is right? Am I trying to solve the problem, or am I trying to prove that my original solution was correct, especially if it was my idea? If it's my idea, I'm much more likely to want to prove that it's correct. What assumptions might I need to let go of? I mean, that's kind of really one of the real challenges that we all have as human beings, but especially as leaders. They're not easy questions, but they're the kind of questions that I think will create better leaders. So the best leaders I've ever worked with over the years weren't the ones who knew the most. In fact, I think as they got older, they realized they didn't have all the solutions, even with all that experience and understanding of doing this business for many, many years. They were the ones who were the most willing to keep learning. That this curiosity, that this, I don't have all the solutions, that the more I know, I realize the more I don't know. I loved being around those kind of people. They didn't collect more information. Yeah, they went to conferences. Yeah, they read journal articles. Yeah, they read reports. But it was about sort of how do you learn about new ideas? How do you expose yourself to this constant continual learning? Because allowing good evidence to reshape how they thought was more important than being right. So our ability to improve is directed uh, by this willingness we have to learn. I mean, they're tightly connected. Real learning isn't about measuring how much information we collect. It's measured by how much better our decision becomes. That's interesting. How much better we can make decisions, how much better our decisions become. So I want to thank you for listening to Viral Healthcare. If this episode made you think differently, I'd encourage you to share with a colleague. And until next time, remember, ideas spread quickly, good decisions last. Thanks for listening to Viral Healthcare. I'm Bruce Spurlock, and I'll see you next time.